You are watching the premier morning show in the land, and we're glad you are part of us. You can be, of course, part of the conversation by joining our socials. On Twitter, the hashtag is morning@NTV. You can register your views on the issues that you hear and see here. But most importantly, we want you to be critical in shaping the discussion and the way forward on national interest issues by commenting and sharing, including those critical aspects within your community that you think should be given attention. We shall be glad to amplify that. Now, on Take Note this morning, we are going to amplify sexual reproductive health rights. And the East African community is at the forefront of ensuring that some of these issues are streamlined and the conduct of all interventions across board from Uganda, Kenya, Tanzania, Rwanda, Burundi, the Democratic Republic of Congo, and South Sudan are harmonized. The Sexual Reproductive Health Bill, East Africa, is what we are going to discuss. Just to give you a preamble of what it is, the bill is anchored on regional and international obligations, including the Maputo Plan of Action for the operationalization of the Continental Policy Framework for Universal Access to Sexual and Reproductive Health Services. Last week, the bill underwent public hearings in various partner states to get the public views and opinion about the bill. But this morning, Annah Kukundakwe, a senior program officer at CEHURD, is here to talk more about the bill. A very warm welcome, Madam Kukundakwe.
Thank you so much.
How are you doing?
I'm doing great, and thanks for having me.
You're welcome. Now, first take us through a preamble of what this bill is before we can get to the nitty-gritty.
So the East African Sexual Reproductive Health Bill is a bill or a legislation that is being advanced by the East African Legislative Assembly with an aim and an objective of promoting safe motherhood, but also eliminating unnecessary death, especially for women and for women when they're giving birth. Yeah. But it has a very unique component of taking into considerations men's sexual reproductive health and rights, because these are conversations, again, that don't come to the limelight. So we think that this legislation is actually going to go a long way in ensuring that men, women, and the young people of East Africa enjoy their sexual reproductive health and rights.
Okay. At what point are we in terms of its implementation?
So the bill is still under development. I must say that it was introduced first in 2017 by Rwandan legislator, Honorable Dete Nyamirimu. And at the point when she introduced it, first of all, the third EALA term of office was coming to an end. So therefore, the bill was not, she could not advance the bill further. But also there were issues of contention or issues of disagreements across the East African stakeholders that needed to be harmonized. So with that, is that with the EALA term coming to an end, then they made a decision that they passed a resolution, actually for the first time in East Africa, that bills that are not concluded in a certain EALA term, or during that EALA term, are actually saved and reintroduced with a new EALA. And that's this is one of the bills that was actually saved and reintroduced within the fourth EALA. So the bill, because there were issues that needed to be agreed upon, the issues that needed harmonization, it went into a process of redrafting. So the bill that we're discussing now is the bill of 2021 June, which is a very progressive bill. It has been redrafted, and from our opinion that actually this bill, the issues of contention or harmonization, these have been dealt with, and we think that all stakeholders can actually come on board and support the bill for the people of East Africa.
Okay, what is the state of sexual reproductive health rights within the region? If you look at, for example, Uganda and all the other countries, just paint us the picture of where we are in terms of, first and foremost, the rollout of information on sexual reproductive health rights, but most importantly, the rights of the people. We have aspects including FGM, we have aspects including gender-based violence that affect sexual reproductive health for many of our people. Where are we most worried about? Is it Uganda, Rwanda, Kenya, Tanzania, or, well, it's something that has been worked on by the local legislation that has already been put in place?
I think all East African states sort of have persistent sexual reproductive health and rights challenges, and these stem from come from either not availing information to them, and specifically to this, I'm sure it's no news. At least every week there must be a story about teenage pregnancy in our own context, Uganda. So each of the countries, partner states, are actually struggling with high cases of teenage pregnancies, and these, of course, are impacting girls or young people's ability to continue in school. We also know that maternal mortality, I don't think maternal death or preventable maternal death is just not a story for Uganda. Each of these countries are actually struggling. If you look at South Sudan, you're looking at Rwanda, you're looking at Kenya, they're all struggling to, with preventable maternal death. Harmful practices, which include child marriages and female genital mutilation. I'm sure that, again, as countries, these are places where we are struggling, and in most of these cases, I know we have the FGM Act, but for example, for like child marriages, talking for Uganda, at least they don't have a legislation on child marriages. So again, the bill is anchored to come and provide a solution and be the magical bullet in preventing these the challenges and for the people of East Africa. It's been said, for example, that the bill or efforts to introduce this particular legislation have been ongoing for the last many years and been hampered by the fact that there is no harmony on how to roll out a program across all countries that is relatable to all. For example, the Maasai in Kenya and Tanzania have their own way of looking at things. The Sabine in Uganda have their own way of looking at things. Other tribes or cultural settings have a way of either being receptive to some of the practices that could be endangering sexual reproductive health rights or not. That lack of harmony could have endangered the rollout of this particular bill. How are we sure that its implementation won't find itself in such troubled waters? I think from the, first of all, we need to start from the place of creating awareness. And learning that, letting the stakeholders know, the Maasai know that the cultural practices that we have, that we are very passionate about, are actually part of the problem that are endangering the lives of our people, and therefore the need to actually deal well with some of them, especially those that are harmful. It is, I think, high time that we had honest conversations about female genital mutilation, and also saying that a girl who is below the age of 18 cannot be initiated into a marriage or cannot even be put into discussions where they have to consent for sex. Now, with that awareness creation, I think it is going to put people in a better place of appreciating the problem, but also making sure that the bill is actually embraced. But also the bill is not coming, it's not a stray child. It is coming to deal with the challenges that we are struggling with. Many girls dropping out of school, the many women dying, the men that cannot talk about their reproductive health. I'm sure every time you're seeing people mobilizing resources for a cancer patient, a breast cancer patient, or prostate cancer or anything. So the bill is coming to actually prevent this. There are couples that cannot naturally conceive or bear children. So the bill is coming in as an opportunity. So the more it is painted as a solution to actually the challenges that the day-to-day challenges that East African people go through, the more it will be received and supported.
Take us through the state of affairs within Uganda's laws. Where are we right now? Because many times in Africa, we could be pushing something at a regional level when our own quotas are very questionable, especially in terms of rights rollout or being able to create awareness, which creates a bit of a contradiction that at regional level there is a mega push while our own legislators or quotas within Uganda, we aren't doing any sufficient work.
I think we must say that as a country, we have relatively progressive laws and policies on sexual and reproductive health and rights. But I also must say that our president is very passionate about East African integration. So looking at our shared challenges that we have as a country and those that we share with our neighboring countries within with whom we share a bloc, and finding a joint solution, we think it's more sustainable. I also must say that in Uganda, when we legislated the female genital mutilation, is that our brothers and sisters in Sebei go to Masai, carry out the practice and come back. So you see that our legislation now is coming to sort of create a harmony, because if we legislate and our neighbor is not taking the critical step, if there is a fire at your neighbor's place, your household is actually at risk. But also to must say that Uganda as a country, we do not have a law on surrogacy, and yet we know that we have very many health facilities, fertility specialists, clinics and hospitals mushrooming. So that is putting many couples, women and men at the mercy of the people who operate the clinics. So the earlier we come to say that we are putting in a solution or a legislation, the better to solve some of the puzzles that we're currently having, but also as a way of achieving even our own development goals, knowing that you cannot develop with a sickly population, and the major cause of our sickness and everything relates to sexual reproductive health and rights, and this is what the bill is coming in to solve.
Wow, that's a very damning assessment of where we are. The fact that most of our problems are, apparently, if what you say is correct, are caused by challenges surrounding sexual reproductive health. You spoke about surrogacy. This is a very little understood concept and practice, especially for African communities, Uganda in particular. Just take us through where we are as a country when it comes to surrogacy.
I must say that as a country, first of all, we do not have a law. And so it is not legislated. That one does not stop the fact that that it's happening. I'm sure I will not mention facility centers, but you know that these are operating. So and these come to, it's a good thing because it comes to provide solution to people who to give everybody an opportunity to carry the banner of joy. You know, and you know what actually having children means in an African context.
In the simplest language there's ever been. I want you to explain to people out there what surrogacy is.
So surrogacy is where, first of all, you use. So surrogacy is where a mother or a couple that is unable to have children naturally, they actually get help, a person to help them with a womb to actually carry a baby. And in most cases, also, it is not just limited to a person carrying a baby, getting a surrogate mother. It also means that there has to be like a contractual obligation to make sure that the tests necessary are being done. The surrogate mother's life is not put at risk, but also at the end of the day, the agreement is actually fulfilled. That if I've carried your baby, then I should not reach at the point of giving birth and I say I don't want to give away the baby.
I'll be very honest. I didn't understand.
Okay.
I want to know somebody lending another a womb and carrying their baby. If a couple, Chris Higenyi and the wife, are unable to get a child, how does it happen that another person carries our baby?
So they will, Chris will go to the laboratory, they will get his sperm, and the sperm will be made to fertilize an ovum that will have been gotten from
whose ovum?
From your wife's ovum, and then they'll get a person to carry the fertilized egg in their womb. In the Muslim man's language, it sounds scientific.
Let me react like my uncle. Interesting there. So, as we speak right now, it is a practice that is widespread in the West. The other day I was reading a story about how the war in Ukraine had affected a lot of orders for these babies. And of course, I hope not Ugandan was affected by that particular development. But that is information that, of course, this particular bill will be able to iron out and ensure that the grey areas are cleared. Just give us more information on that. Is something
I think I must say that most couples or most people, men and women, struggle with infertility, and that is a conversation they cannot have openly.
So surrogacy is a very good solution to infertility.
It's a solution to enable, because if I'm infertile, it means I'm not able to carry a baby naturally through the nature. So if the science is there and the technology is there to help me experience the joy of motherhood, and now in the mostly layman's language, that's what surrogacy is actually coming to help, to make sure that couples that are struggling with infertility are actually given an opportunity to hold to have a baby. And
the emotional aspect there is that after carrying someone's baby for 9 months, there is an attachment to that baby. What if there is a change of heart and somebody says, please, I've carried this for 9 months? Like the argument always goes, I carried you for 9 months in my womb. How can you, there is that, how is it that law, can it particularly cater for that, or has it been included within this bill?
That's why we need to have it legislated. Because now what is happening is that everybody is operating on their goodwill. And because there is no law that protects the couple that is maybe aspiring to have a child, that protects the health facility where this process is actually carried out, but also protects the person, the surrogate mother, from exploitation. Now this bill and that specific section of the bill is coming to make sure that every party is protected, and of course all those issues. But now we are risking all that without a law and without a legislation.
Very quickly, take us through the very other contentious aspects of that bill, the issues rather, because surrogacy seems to be very.
I think I wouldn't really want to call them contentious. I think these are issues where issues that need to be harmonized or agreed upon. And I know for a fact that one of the issues that have been not very well received is the issue of comprehensive sexuality education. And with this, of course, it is being misinterpreted as an opportunity
sex education,
but also as a way of promoting sexual immorality. And I think I want to use this opportunity to clarify that this bill is in tandem, or is cognizant of the social cultural issues within the region. This comprehensive sexuality education, I think, as a country, we've come onto a harmonization of sexuality education, and these are really just semantics of looking at a young person holistically and giving them information on nutrition, on teenage pregnancy, prevention of HIV, and all that, and that is what we are terming as comprehensive. So it's important that people do not look at this as an as something as people who are trying to push immorality, but it is an opportunity to actually provide the young people with the information they need to make the right decisions about their health and their sexual reproductive health and rights and need. I think the other issue is about abortion. Abortion. Again,
very quickly.
And with this, and the bill is saying that countries the bill is emphasizing the fact that countries are going to the already existing legal frameworks in countries are actually going to be considered when it comes to the issue of abortion. So for Uganda, if we are saying that abortion is going to be allowed in these circumstances that are stipulated in our constitution, that is what the bill is coming to reinforce. And already they are saying, and also because as countries we say that access to post-abortion care services is a given, because life must be saved. Again, that is what the bill is coming to reinforce. It is not introducing anything new. It is already what countries are already doing, but sort of giving it more power and enforcing it to make sure that it's effective. Ms.
Kukundakwe, where are the public hearings being held so that Ugandans' opinions can be registered? Very quickly.
I think the public hearings were concluded last week in all partner states. Our own public hearings were here in Munyonyo on Wednesday.
Why Munyonyo? The people who need sexual reproductive health information can't make their way to Munyonyo. Why Munyonyo?
They were in Munyonyo, but there were also online discussions. The public hearings were streamed live on Facebook, on Twitter, on YouTube. So for people to register to give in their views and opinions about the bill. And I must say that they were very well attended. So I'm sure Ugandans were able to give their candid views about the bill.
Many thanks. Annah Kukundakwe, a senior program officer at CEHURD there, demystifying the East Africa Community Sexual Reproductive Health Rights Bill that is in the offing. That's it for Take Note. I hope you've taken note of everything you need to with regard to this very, very important topic. Stay with us. A Kickstarter will be coming up next, and we shall be keeping within the confines of the East African community and understanding the politics away from the social issues.